Hello friends, I am Dr. Krishna Patil. I am a consultant nephrologist and I am passionate about utilizing natural methods in helping patients lose weight, control blood sugar, control blood pressure and prevent the progression of chronic kidney disease. And in line with this, today I am going to briefly discuss the role of autonomic nervous system in helping in all of these. So as you all know, many of our body's functions are automatic, like our heart rate, our blood pressure, our digestion, our breathing, our sleep quality. All these are not directly governed by us and they have a proper control due to our autonomic nervous system. This autonomic nervous system has its two wings, the sympathetic and the parasympathetic. Like in nature, there is the sun and the moon. The sun represents activity and the moon represents restfulness and peacefulness. In the same way, our body also needs to be in a fight or flight mode sometimes and it needs to be in a restful mode sometimes. The sympathetic nervous system, the part of autonomic nervous system which governs fight or flight response of the body, it generates stressfulness in the body. It increases your heart rate, it increases your blood pressure, it increases the blood sugar level, it increases all the stress hormones in the body like the cortisol, noradrenaline. It makes you ready to fight or flight. So, whenever you are under stress, it is the sympathetic overactivity. Whereas, to counterbalance that, as in nature, to counterbalance the heat of the whole day due to the sun, the balance is achieved by the moon and its cooling effect. In the same way, our body also needs restfulness. And restfulness is the mother for digestion, reducing the acidity, improving quality of sleep, reducing blood pressure, blood sugar, and improving the healing potential in our body. So it's very crucial that we utilize our autonomic nervous system for our benefit to reduce the stressfulness in our body, to improve the quality of sleep, to improve our digestion, reduce the hyperacidity, reduce the blood sugar, blood pressure and stress hormones in our body and help the body to heal. So the better healing can happen if we have an improved parasympathetic tone. And more the body is continuously in a sympathetic overactivity, that's the continuous or a chronic stress in our body, our healing potential will be affected. The quality of sleep will be poor, the digestion will be poor. So rest and digest is parasympathetic nervous system. I would also add healing to it, and fight, flight or stress is sympathetic nervous system. Now, how to improve our restfulness during the day? Now, much of our activity or our response is based on the external stimulus. So how we respond to the external stimuli, and all the externals are beyond our control. What I typically tell my patients, you can't stop the rains. You can't control your externals. You can't control the circumstances. But how you respond, you can control. You cannot stop rain, but you can take an umbrella and protect yourself. So even during the fight and flight mode or your busy schedule or your busy stressful day, you can put your body to restful mode, improve your digestion, improve your sleep quality at night, and to keep yourself in a healing mode by keeping your parasympathetic tone high. And how we can do that? It's an open secret. Like in yogic system, they call it the Chandra Nadi and the Surya Nadi. Chandra Nadi is the parasympathetic nervous system and the Surya Nadi is the sympathetic nervous system. So there is a very important pranayama in the yogic system called the Nadi Shodhan Pranayama, which improves our autonomic nervous system, and thus we can govern our heart rate, our blood pressure by improving the parasympathetic tone. And this Nadi Shodhan Pranayama is also called the Anulom Vilom Pranayama. What it typically does, it typically involves slow and deep inhalation, holding the breath, and slow exhalation. I want you to do a small exercise yourself to understand the effect yourself. So now due to COVID, most of us have a pulse oximeter at home to monitor our oxygen levels. You can also use it to check your heartbeat or the pulse rate. So I want you to place the pulse oximeter on your index finger. See what is your basal heart rate. Note it down. Then you take a slow and deep inhalation. Your abdomen should come out. Take a full and then the whole chest expansion. Now that you have inhaled fully, observe what happened to your heart rate. You may notice while you are actively inhaling, your pulse rate may slowly go up and then it will stop at a particular point. And when you are holding the breath, the longer you hold, you will keep noticing that your pulse rate will start to come down. Till the time you are comfortably holding your breath, your pulse rate will keep coming down and down and down. And when you start feeling uncomfortable holding it any longer, you start slowly exhaling and then again your pulse rate will come up. So the holding portion, that's the time when the intrathoracic pressure is fully negative. There is more blood rushing because of the negative pressure in the chest. More blood coming to the heart. So the more blood being pumped by the heart. So the carotid baroreceptors stretch. And they give a signal to the brain that there is overactivity, more blood coming to the brain, improve the parasympathetic activity and reduce the sympathetic activity so that this can be regulated. And so the holding exercise improves the parasympathetic tone, and the longer you can comfortably hold your breath, the more the parasympathetic activity will be exercised. And thus, the deep breathing and holding it comfortably is going to improve your parasympathetic tone or the Chandra Nadi, and typically it will improve the autonomic nervous system, which governs your digestion, your restfulness, your stress levels, and thus even during your stressful day, you can keep yourself protected from the effects of that stress. You can keep the stress hormones low, and thus you can reduce your heart rate, you can reduce your blood pressure, you can reduce to some extent your blood sugar, and you can reduce the acidity in your belly, you can reduce the bloating sensations, you can improve digestion, and you can improve the sleep quality if you do this deep breathing exercise before sleeping, putting your body to restful mode. And thus, if you practice slow deep breathing throughout the day, you are likely to help your body heal from all these stressful events or the wear and tear of the whole day's activity. So I would recommend, to prevent progression of kidney disease, improve the healing potential of your kidneys or your body, please practice every day whenever you get time, slow deep inhalation, holding, and slow exhalation. With this, I have personally and also in amongst my patients noted it helps the reducing of stress hormone. Cortisol helps lose weight because cortisol causes insulin resistance, and increased insulin leads to increased weight gain. So it helps in reducing, it helps in weight loss, it helps in blood sugar, blood pressure, and progression of kidney disease or any chronic disease for that matter, by improving the body's healing potential. So I recommend to most of my patients to be observant of their sympathetic and parasympathetic activity and help their body improve the parasympathetic tone and help themselves prevent all these chronic diseases. I hope this video is helpful for all my patients and whoever wants to lose weight or control blood sugar, blood pressure naturally. This doesn't mean that this is the only way and it can fully control things. You definitely would need medical help if if the blood sugars are high, blood pressure is high, but this is an adjuvant, or this is definitely going to help all of your attempts in reducing your diabetes, BP and kidney disease or heart disease. If you feel this video was helpful, you can share it amongst your friends, neighbors and your colleagues. Help them understand or motivate them for slow deep breathing. Thank you.